So this is part actually of a 3-part series we are doing called Nutritional Considerations for Adults Over 50, Maximizing Quality of Life. The last time we talked about sarcopenia, and that is age-related muscle loss. And as you hopefully learned, there's a lot you can do to prevent the loss of muscle. Primarily, the takeaway there was a high-protein diet and strength training, really important. And you don't have to wait till you're 50. Even though it says over 50, this stuff starts when you're younger, just like bone loss, So if you are over 30, pay attention.
Yeah. So Jeannie is on. Hi, Jeannie. Thanks for joining us.
Awesome. Great to have you here, Jeannie. So this talk is about osteopenia and osteoporosis and nutritional interventions to reduce the risk of bone loss. And next talk will be on cognitive decline. And so what can we do right now to reverse or slow down these diseases, right? What are some nutritional interventions and lifestyle interventions that we can use to improve the quality of life for ourselves, but also our parents? A lot of us are also taking care of aging parents, and there are things that can improve their quality of life in these talks. You might want to take some notes. Okay. Prevention, though, is really key. All right. So there's this misconception, and I think I know where it comes from. Maybe Tiffany, you have ideas, but that bones are made up of dead tissue. And I think it comes from looking at skeletons in an anatomy class or in the classroom, because the bones are all calcified and hard, right? But actually, like, bones are living tissue, and they're actually organs. Did you know that? They have cells, nerves, blood vessels, pain receptors, and they can become unhealthy over time. And the other misconception, I guess, about osteopenia and osteoporosis is that it's a woman's disease and something only old people get. But actually, they can affect both men and women, especially after the age of 30, just like muscle loss. And if you don't take care of your bones, you could end up with osteoporosis. Osteopenia is kind of like the midpoint between having healthy bone tissue and having osteoporosis. So with osteopenia, it's kind of like a slippery slope toward osteoporosis. Your bones are thinner and they're less dense. And, one of the things that can happen with aging and with menopause is the risk goes way up for bone mineral loss. And also, for men who have low testosterone levels, they have the higher odds of getting osteopenia, which is that precursor to osteoporosis. And in fact, studies suggest that approximately 1 in 2 women and 1 in 4 men after the age of 50 and older will break a bone due to osteoporosis.
That's high. Like that's 50%. One of us is going to break a bone.
Yeah.
Not me, because I'm going to start eating my calcium.
Good for you. That's awesome. I mean, and sometimes I think we don't even know it's because our bones were at risk. We just say, well, I fell and I fractured, but had the bones been healthier, there might not have been a fracture. Mm-hmm. And the sad thing is this is largely preventable. Mm-hmm. It's really important to keep our bones healthy and avoid these fractures, because according to the Bone Health and Osteoporosis Foundation, a woman's risk of breaking a hip is equal to her combined risk of breast, uterine, and ovarian cancer.
That's insane.
We don't talk about this. We talk about cancer. We don't talk about, bone health that much. And I mean, we're all aware of somebody who broke their hip in old age, and this is a really serious thing.
I think that the reason why it's not talked about is because a lot of people are like, it is what it is. I'm aging. It's just going to happen. Right. Whereas whenever we think about cancer, we think of it as a disease and something that's attacking our body. And whereas when you think of your bone and breaking a bone, it's just something that happens as we age. And I think that changing that narrative is very important.
Yeah. And the other thing is, we don't know we're losing bone. Mm-hmm. Unfortunately, like, it's a silent killer. When you have other diseases, you don't know when your bones are unhealthy necessarily. You have to go for a DEXA scan to find out. So here's a quote from the National Library of Medicine. Bone is a living tissue that is constantly regenerating. It's made up of the mineral calcium, which makes the bone strong, and collagen, a protein that makes it more resilient. This should give you a clue that both calcium and collagen protein are important. Significant bone development begins in infancy and continues into early adulthood. And it's important for adolescents to make healthy choices to invest in their bone health, as 90% of peak bone mass is acquired by age 18 for girls and by age 20 for boys. So their nutrition is really important, and so is their activity levels, not to be on their phones playing video games, because they're not going to build as much bone structure as they're going to need. By age of 30, bones have reached their peak bone mass or maximum bone strength and density. And by the time people reach their mid-30s, their bones slowly begin to lose mass. As bones begin to lose mass, risk increases for diseases of the bone, most commonly osteopenia, which is chronic low bone mass, and osteoporosis. And osteoporosis is a bone disease that it's preventable, remember. It occurs when the body loses too much bone, makes too little bone, or both. And as a result, bones become weak and may break from a fall, or in serious cases, even from sneezing or minor bumps. Crazy. Imagine your bones are so brittle and fragile that you sneeze and break something. But for somebody with very advanced osteoporosis, even minor activities such as a sneeze or a cough or a jump can be enough to cause a fracture. My own grandmother, very active, up into her 80s, playing 10-pin bowling. And then when she turned about 90, I think 92, she got up I talked about this in the last talk. She put her feet on the floor, getting out of bed, and went to stand and snapped her shin bone. That's all it took, was weight bearing. And she had no idea she had osteoporosis. And that's when most people find out, after they break something. So if you're concerned, you can go and get a test. You can get a DEXA scan, which is like an X-ray of your bones. You don't want to get the one that does body composition and muscle testing. You want to get an actual X-ray for your bone health, and you can talk to your physician about it. So if you look at these pictures and these images, you can see the difference between, like, I would say on the left, bone is naturally porous, but on the right, you've got a lot more holes in it. It's almost like more holes than structure. And that's osteoporosis. And your body constantly absorbs and replaces bone tissue. But with osteoporosis, that new bone creation doesn't keep up with old bone removal. And many people don't have any symptoms until they have a bone fracture. And osteoporosis actually means porous bone. And so when you view bone under a microscope, healthy bone looks like a honeycomb. But when osteoporosis occurs, osteoclasts break down the tissue and bones and release the minerals into your bloodstream. And that transfers the calcium from bone tissue to the blood. And the bone loses its bone density and becomes fragile and porous. So you can see just how porous it becomes and how much structure has been lost over time. So as we age, we tend to absorb more of the minerals from the bone tissue and form less of it. So who is at risk? As I mentioned, it's most common in postmenopausal women and men with low testosterone. Menopause significantly speeds up bone loss and increases risk. And research indicates that 20% of bone loss can happen during menopause. Why? Estrogen. We have this drop in estrogen, and it affects our bone health. And again, 1 in 2 postmenopausal women will have osteoporosis, and most likely will suffer a fracture during their lifetime. So we want to avoid fractures. Why? They cause pain. They decrease our mobility. They make us more fear of being physical. And that creates a loss of independence. So there's a decrease in the quality of life. But also, fractures lead to more mortality.
Yeah, I think that it's really important to be able to maintain your independence, because once that independence is gone, your quality of life, I don't know about you guys, but I want to be able to take care of myself as I age and not have my kids take care of me. So,
Yeah. Yeah. I mean, according to a research paper, it looked like a conducted study. They investigated like patients who had hip fractures that were 65 years of age and older, and the risk of mortality in hip fracture patients was 3 times higher than general population. Adjusting for different causes of mortality, it was still like 3 times as high. So you really want to avoid getting fractures in the first place. So what are some of the causes? There are medical causes here. Sometimes there can be a medical condition that can trigger the condition. In females, even young people can get it. There's something called the athlete triad. I'm sure, Tiffany, you know about it. It's a combination of disordered eating, amenorrhea, which is a loss of your period, and osteoporosis. And it's a disorder that often goes unrecognized. So people who having a lighter body weight will help them with their athletic performance. And unfortunately, there's some bad coaches out there, running coaches, gymnastic coaches, who want girls to maintain almost a prepubescent body or be underweight in order to have better performances, faster run times, things like that. And they're at risk of not developing enough bone density. Mm-hmm. Eating disorders can also cause it. Anorexia, bulimia, that can starve the body of nutrients needed to keep bones strong. You have a thought, Tiffany?
It's just frustrating. I'm just thinking about all the teenage girls out there that may not be suffering yet, or maybe suffering silently because they just wanted to be competitive, and the training that they did negatively affected their body versus positively affected it, because that's an option. That's a possibility too. So it's really important to train smart.
Yeah. Yeah. Well said. Health is number one. Mm-hmm. So other causes include things like untreated celiac disease or an overactive thyroid. Too much thyroid medication can also make you lose some bone density. Chemotherapy, exposure to radiation can have an effect. Certain medications, hydrocortisone, prednisone, those steroids, anti-seizure drugs can also result in less bone density. So if you are taking medications, it might be worth checking with the pharmacist to see if this is one of the side effects, just so you can be more mindful and mitigate risk. And are there lifestyle causes? For sure. Being sedentary can also be problematic. Poor nutrition, low protein, vegetables. I mean, this is very similar to what we talked about in our last one, right? You want a high protein diet. You want to eat lots of vegetables. Also, I don't know why I have loss of independence there. That was a mistake. But other things not on the slide, but actually they are. Excessive alcohol. That actually interferes with calcium balance. And it's so important for healthy bones. And alcohol also disrupts calcium balance and interferes with the production of vitamin D, which is another essential vitamin for calcium absorption. Smoking, nothing good about smoking. It reduces the blood supply to the bones. And so if you can stop smoking, like for a whole bunch of reasons, that would be good. It also decreases the body's ability to absorb calcium. So those are some things that you want to avoid or limit or mitigate against. So what can you do? You want to stay active. You want to do weight-bearing activities and strength train 2 to 3 times a week. And, you can use weights, you can use bands, you can use body weight, but you should be working your muscles. That is going to help your bone structure. And especially those muscles that are in your upper back, so you don't develop that curved spine. You see some elderly people shuffling down the sidewalk, and it almost looks like they could be so stiff and bent that the head is coming out of the chest almost. It's important to strength train. We talked about it. I keep harping on it. I feel like a broken record, but honestly, it is the anti-aging drug. If doctors could prescribe strength training and people did it, I think it could fix a lot of problems for people.
And I think that it's important to note here is that people think of strength training and they just automatically get overwhelmed. I don't know where to start. I don't know what to do. I already have X, Y, and Z injury. And that goes back to what I said earlier about the teenage girls or the young girls. It's all about training smart. Start where you are. Start slow. You don't have to do everything at once. You got to walk before you learn how to run. And even before you walked, you had to learn how to crawl. So it's a process.
Yeah. And what is the trajectory of inactivity? It's terrible. It's absolutely a terrible outcome for people, for their quality of life. So you might have injuries, but you can work around those injuries.
And then you can actually decrease that trajectory that you're currently on.
Yeah. And a lot of back injuries can be helped with weight training. I myself had a terrible back situation that time off work, tons of therapy, medication, etc. It only got helped and I only became pain-free after weight training. No back problems for years now because I weight train consistently. But after the age of 30, men and women can prevent bone loss and muscle loss with regular exercise. And so those activities that you want are weight-bearing things like hiking, walking, running, dancing, tennis. Non-weight-bearing activities, things like swimming, right? Because you need to work against gravity to keep your muscles and bones strong. And I mean, swimming will have some muscle and cardio benefits, and it's great. But honestly, nothing beats self-propulsion on land. You also want to maintain a healthy body weight. This is also important because people who are underweight are more at risk of bone loss. There's a reason why astronauts lose bone density in space, and it's because their bones do not undergo the stress of supporting their bodies against gravity. And that weight loss condition that they go through, they can actually lose 1 to 2% of their bone mass every month that they're in space. And once they return to Earth, it can take 3 or 4 years for those bones to recover. And this is NASA scientists trying to mitigate risk for them with supplementation and diet and exercise and all the things. And it's still taking years for them to recover. So stay healthy, stay active, eat well. And we've talked about calcium, so important. Men, the recommended nutrient intake is 1,000 milligrams a day. For females, 1,200 milligrams a day. If you do not get calcium and vitamin D, this can cause hyperparathyroidism. And that's where you actually leach the calcium from your bones. So make sure you're eating enough calcium. And if you're not eating enough calcium, you can supplement it. But don't totally rely on supplements. I mean, they can give you increases in bone mineral density similar to supplements, but whole food is always better because you don't want just a calcium supplement and miss out on whole foods and vegetables and stuff, because you're also getting fiber and phytonutrients and vitamins from those vegetables. And that just keeps you healthy.
If you're wondering how to track it, a lot of the trackers out there, the diet trackers, nutrition trackers, they will give you a breakdown of how much iron, vitamin A, calcium that you're taking a day. So most apps will do that, and some don't. The one that I use does not do that. So if you wanted to just take a look at your tracking history and ask yourself, am I close to this recommendation? If not, what changes can I make? What foods am I eating that are higher in calcium? How can I incorporate more of those into my daily diet?
Yeah. And when you might think you're covered because you're taking a multivitamin or multimineral, but look at the label, because sometimes what they do is they stuff in minute amounts of vitamins and minerals on. So it just looks like, oh, lots of things on this label. But when you look at it, it's not even close. It might be 2% of the recommended daily allowance. Yeah. So read that label, find out what percentage of the recommended daily allowance you're getting. The other sources of calcium that can come from whole foods, don't be afraid of carbs. They're a great source of essential vitamins like minerals. Things like soybeans, dark green leafy vegetables like spinach, calcium fortified foods, figs, flour tortillas, even canned baked beans, all contain decent amounts of calcium. And dairy products like milk and yogurt and cheese, those are rich in calcium and some of the most absorbable calcium that you'll get. Salmon, sardines, fish with bone in it are also high in calcium. Vitamin D, you need vitamin D, and unfortunately 42% of the US population is deficient, according to research published by the National Institute of Health. So most people could benefit from vitamin D supplementation. Also, people who are obese tend to have lower vitamin D levels, and some people just genetically have a harder time absorbing vitamin D. Or because of their skin pigmentation, the darker you are, the less vitamin D you absorb from the sun. So you really do need to look at supplementing. You can check your vitamin D levels with your doctor, but chances are you're going to have to pay extra for that blood work. It's going to help you absorb calcium. You can find it in eggs, oily fish like salmon and sardines, and from the sun. One thing I think I didn't touch on here was, 400 IU, not a very big amount of supplementation, increased bone mineral density in these research subjects. And when you think about your parents or anyone you know who might be in an institution, 35 to 90% of the institutionalized elderly are estimated to be deficient in vitamin D. So you could probably buy them some vitamins and ensure that they're taking it, because they're just not getting out in the sunshine. A lot of them are living very sedentary lives indoors. So that's something to think about. Any questions so far?
No, but Patty did pop on and say hi. So hi, Patty. I've been waiting to say hi back.
So some practical recommendations. Again, you want to exercise. You want to do physical activity, particularly weight bearing or resistance exercise. Consider supplementing your calcium with a calcium supplement. You need about 1,200 milligrams a day if you're over 50 and female. Optimize your vitamin D levels by getting outside in the sun and having foods that are high in vitamin D or supplementing. Collagen might be helpful. And eat your veggies and protein at every single meal. It's so beneficial for your overall health. And if you look on the right, I've got a table here which shows great calcium sources. So milk, one serving of milk is 352 milligrams of calcium. Remember, you're shooting for about 1,200, right? Some yogurt, salmon, spinach, it all adds up to your daily totals. So I just want to mention once again, osteoporosis is a condition that can be reduced, eliminated, or prevented by following healthy lifestyle guidelines. And hopefully this is giving you some thought about what you can do to ensure you have healthy bones as you age.
I just noticed something kind of interesting about this slide. Look at spinach. 110 grams of spinach, 109 grams of calcium. That's like 1 for 1, basically.
Yeah,
spinach,
that's true.
Spinach for the win.
But 110 grams would be a lot.
Yeah, you're right.
It would be a lot. It would be several cups. But it's coming from whole food sources. Now you can look at some processed food that's fortified with calcium and vitamin D. You could consider that as well. I think they're fortifying
cereals.
Yeah.
Orange juice. A lot of orange juice now has with calcium and stuff in it too.
Yeah, exactly. So next week, we're going to be talking about brain health and neurodegenerative function. And we'll touch on undesired weight loss because that can happen in the elderly. They lose their appetite. And when they lose their appetite and they start losing weight, that is a slippery slope that doesn't have a good outcome. So we can talk about that if you're caring for a loved one who's maybe not eating as well as they could. And we'll give you some practical nutrition tips there. And I just want to mention our new U program. We have a diet program, but we also have a diet plus strength training program. And that's 3 months of customized and personalized coaching where you get to work one-on-one with a coach to improve your diet and strength train and mitigate against these types of risks that we're talking about.
And train smart.
And train smart. Yeah, we will create a program. We don't do cookie cutter programs. We create a program for you, your specific goals, your lifestyle, how often you want to train, if you want to work out in a gym or at home, what kind of equipment you have. All of that is individualized to you, along with a macronutrient focused diet program.
Yeah.
That's it this week. Thank you so much for your time. We appreciate you listening and tuning in, and we'll see you next week.
Bye.
Bye-bye, everybody.